Did you know? 1 in 3 people will develop cancer at some point in their lives. But here's the worrying part. Every year, millions of cancer cases are diagnosed too late, simply because the early warning signs were overlooked. According to the American Cancer Society, if cancer is detected at its earliest stage, the chance of successful treatment can be over 90%. However, if diagnosis is delayed until the cancer has advanced, survival rates can plummet to below 20%. In the next few minutes, I'm going to reveal 8 subtle warning signs your body could be sending you. Signs that are easy to miss, but could literally save your life. These aren't your typical, well-known symptoms. These are silent signals backed by medical science, and many people have caught cancer early because they paid attention to them, when treatment was still highly effective. Now, I know what you're thinking. These days, it feels like every little backache or wave of fatigue gets blamed on cancer thanks to something we read online. But don't worry, this video isn't here to cause unnecessary panic. We'll be focusing strictly on warning signs scientifically verified by medical experts, not internet myths or rumors. The information you're about to hear could make the difference between catching a deadly disease early or missing it completely. 1. Persistent bone pain. One often overlooked symptom that could point to cancer is persistent, unexplained bone pain. Unlike muscle soreness from working out or minor injuries, bone cancer pain tends to worsen over time and often becomes more intense at night. When cancer grows inside the bone, or when it spreads, metastasizes, to the bones, it alters the bone tissue structure, causing a deep, aching pain that just won't go away. The most common type is osteosarcoma, which typically affects long bones like those in the arms and legs. At first, the pain might feel similar to a minor sprain or muscle strain, but over time, it becomes constant and harder to ignore. Some patients describe the sensation as a deep, relentless ache, even after taking over-the-counter painkillers. If this pain is accompanied by swelling, tenderness, or even sudden fractures, it's critical to get it checked out. Catching it early can drastically improve treatment outcomes and prevent serious complications down the line. 2. Eye pain or vision changes. Your eyes are not just the windows to your soul. They can also reveal important clues about your overall health, and in rare cases, early signs of cancer. The most common eye cancer in adults is ocular melanoma. The early symptoms of this cancer are subtle, so subtle that they're often mistaken for ordinary vision problems. Signs to watch for include blurry vision that doesn't improve with new glasses, flashes of light, or the appearance of a dark spot on the iris, the colored part of your eye, especially if that spot changes size or color over time. If you have lighter colored eyes or fair skin, your risk for ocular melanoma is higher. Advanced imaging tools like digital retinal scans can help doctors spot hidden issues inside the eye before you even notice major symptoms. Don't ignore persistent eye pain or unexplained changes in your vision. Early detection could save your eyesight and your life. And remember, regular eye exams are crucial, especially if you're often exposed to sunlight or have a family history of eye cancer. Before we move on to the next sign, if you're finding this video helpful, don't forget to share it with someone you care about. And hit that subscribe button so you never miss our latest health tips. 3. Unusual skin rashes. When it comes to skin changes, not all rashes are harmless. Some may look innocent, but in reality, they can be a serious red flag that needs immediate medical attention. One example is skin symptoms caused by leukemia, a cancer of the blood-forming tissues in the body. Leukemia can cause small, round spots on the skin called petechiae. These are a result of low platelet levels, which are essential for blood clotting. When platelet counts drop, tiny blood vessels called capillaries can leak, creating these pinpoint red, purple, or brown dots under the skin. They usually show up on areas under pressure, like around the ankles or under tight clothing, and they don't fade when you press on them. Unlike typical rashes that are itchy and clear up on their own, petechiae from leukemia tend to linger and may come with other symptoms like easy bruising or unexplained bleeding. If you notice these dots and they don't go away, or if they're paired with other signs, don't ignore them. It's your body's way of warning you something serious might be going on. 4. A strange stripe on your nail. One often overlooked warning sign is a dark vertical stripe under your fingernail or toenail. This could be subungual melanoma, a rare but dangerous form of skin cancer that develops beneath the nail. It usually starts as a thin, dark band running along the length of the nail, known medically as melanonychia striata. What makes it different from normal nail pigmentation is that it appears suddenly, often grows wider over time, and can have an uneven color or blurry edges. Thumbs and big toes are the most commonly affected, but it can happen on any nail. The problem? Many people mistake it for a bruise, fungal infection, or minor injury, and delay seeking help. Warning signs to look for. The stripe is wider than 3 mm. It has varied colors or blurry borders. Pigment starts spreading to the surrounding skin, Hutchinson's sign. If you also experience pain, nail splitting, or bleeding, it's time to see a dermatologist, fast. Early detection is absolutely critical for beating this aggressive cancer. 5. Night sweats with no clear cause. If you often wake up drenched in sweat, even when the room is cool, it might be more than just your thermostat. While night sweats can be triggered by menopause or anxiety, persistent, unexplained night sweats may be an early warning sign of lymphoma, a cancer of the lymphatic system. It's crucial to distinguish between normal night sweats and those tied to cancer. In lymphoma cases, sweating is often paired with what doctors call B symptoms: fever, unexplained weight loss, and intense fatigue. Why does your body react this way? When cancer cells are present, the immune system kicks into overdrive, releasing inflammatory chemicals that mess with your internal thermostat. Lymphoma also disrupts the lymphatic system, the network that helps fight infections, leading to problems with temperature regulation. Occasional sweating isn't alarming, but if you're waking up soaked night after night like you just stepped out of the shower, it's a major red flag that needs attention. 6. Persistent acid reflux that won't go away. Chronic heartburn, also known as GERD, gastroesophageal reflux disease, might seem like a minor nuisance, but if it doesn't improve with lifestyle changes or over-the-counter medications, it could be an early sign of the esophageal cancer. Unlike occasional reflux, heartburn linked to cancer tends to resist standard treatments. Over time, constant acid exposure damages the lining of the esophagus. This ongoing irritation can trigger a condition called Barrett's esophagus, where the normal cells begin to change, a known precancerous stage. If you experience symptoms like difficulty swallowing, food getting stuck in your throat, or unexplained weight loss along with persistent heartburn, don't delay. If antacids haven't worked after 3 weeks, it's time to see a specialist and get checked properly. 7. Yellowing skin, a silent signal from the pancreas or liver. If your skin or the whites of your eyes suddenly turn yellow, this is not something to ignore. It's a classic sign of jaundice, which happens when a pigment called bilirubin builds up in your bloodstream. While jaundice can have many causes, a sudden onset in adults can be an early warning sign of pancreatic or liver cancer. With pancreatic cancer, tumors can block the bile duct, causing bile to back up and leak into the bloodstream, giving your skin a yellowish tint. It often starts subtly and worsens over time as the disease progresses. Since the pancreas is located deep inside your abdomen, early detection is difficult. If yellowing skin appears along with upper abdominal pain, dark urine, or pale-colored stool, don't ignore these symptoms. They might be your body's cry for help. 8. Persistent, unexplained fever. If you've been running a low-grade fever for weeks or keep getting fevers without a clear cause, This could be your body's response to cancer cells, especially in blood cancers. Unlike fevers caused by infections, which usually resolve within a few days, cancer-related fevers are stubborn, cyclical, and hard to break. Cancers like leukemia and lymphoma can trigger your immune system to release inflammatory molecules called cytokines, which keep your body temperature elevated. These fevers often come with other signs like night sweats and rapid weight loss. Some people experience cyclical fever patterns, which are especially common in blood-related cancers. If your fever is over 100.4 degrees, 38 degrees, and persists for more than 2 weeks, or keeps coming back with no clear reason, it's time to see a doctor. Blood tests can reveal cellular abnormalities or other red flags linked to leukemia or lymphoma. And while it doesn't always mean cancer, early detection could be the difference between life and death. Thanks for watching. If you found this video helpful, hit that like button and share it with someone who needs to see it. And of course, don't forget to subscribe so you never miss out on more life-saving health tips and science-backed content.